Good morning, everyone, and welcome to a very quick episode of DiaPoint TV. I want to talk to you about the signs and symptoms of diagnosis for type 1 diabetes. I was going to wait until November to do this, but honestly, that might be a little bit late because the symptoms of type 1 are often confused for the flu or urinary tract infections or other things that cause type 1 to go unnoticed. So as it's end of September and children are back in school and the flu starts going around this time of year, I think it's important that everyone be aware of the signs and symptoms. You may have seen me post things about this before, but it's important to be reminded of it every year because you never know when a diagnosis can happen. So some of the most common signs that people notice first is drinking too much water, urinating too much. In small children, they'll have maybe reversal in toilet training or wet the bed, even children as old as 6, 7, or 8. My son was diagnosed at 20 months old, and the first sign was that he was drinking so much water and kept asking for so much water. And he was still in his nappies, in his diaper, starting to toilet train, but he was kind of going backwards, and he would fill them. They would be so full of urine, which it was not usual for him. So it kind of raised a red flag, and I thought, that's interesting. And the thing that tipped me off, as a child, I had a dog, and this dog actually was tested for diabetes several times because he was drinking too much water and urinating excessively. And I drove miles and miles. At that time, there were no specialties for animals. And he had an adrenal gland problem. So he had a different problem. He didn't turn out to be a dog that had diabetes. But that experience has always stuck with me. And I thought, well, this could be a problem. My son was scheduled to go for a checkup the following week. And instead of waiting until that week, I called the doctor, I believe it was a Wednesday night, and made an appointment for the next day. And the doctor checked him, he looked, he seemed fine, and I said, well, he's been drinking a lot of water and really urinating a lot. Could he have type 1 diabetes? And this doctor's a very good doctor, board certified from the US, really great pediatrician, and he said, no, not possible. It doesn't run in your family. I don't think so. I said, no, really, I think we should check. And he said to me, if it will give you peace of mind. My mind has not really been peaceful since. That day, my son's blood sugar, I think, was something like 640. And we checked for ketones in his urine. And immediately we went off to the hospital and spent our 3 days or so there, getting his blood sugar and everything stable. Now, sometimes what will happen when you go in a doctor's office and you present a child that's urinating a lot, and sometimes they may have stomach pain, the doctor might say, oh, it's a urinary tract infection, here's some antibiotics. Other symptoms, I've written them down just so I don't forget because there's many, and I can list these off all the time, but for the sake of video, we don't want to forget. So hunger, weight loss, that often happens with high blood sugars, and the body starts going into what is called diabetic ketoacidosis, or DKA. And what DKA is when there's so much sugar in the body and the body can't put it anywhere. That's why the body starts urinating and why people with diabetes get an unquenchable thirst, because they're trying to get the sugar out of their body. So once that happens, then it can become quite severe. Sometimes there'll be a fruity-like smell on the breath that you may or may not notice. Moods can change for some, others it doesn't. Or they'll just feel really fatigued and weak and like a flu. And DKA will also cause someone to vomit. It will give them nausea because they just feel so sick. And it can get progressively worse very quickly. So if you suspect that your child might be having the symptoms of type 1 diabetes, please do not wait. Take them to the doctor the same day to get their blood sugar checked. They'll start with a simple finger prick, and you might be thinking, oh, that's awful, I don't want them to do that to my child. But I promise you, catching it earlier is much better than catching it later and having all the challenges that come with that. A person a child, an adult that has type 1 diabetes and does not have insulin can die in a matter of days. So it is a medical emergency, and often by the time it is caught, there is some evidence of DKA because no one suspects it. But please be aware. Please ask your doctor if you have any questions or concerns about it. And have a good rest of the year, everyone. Thank you.